Hello, my name is Brianna McCullough, and this will be a presentation of the historical timeline of healthcare. A little bit of background on the timeline I will be using in this presentation. We're going from 1765 to 2015 and highlighting a few of the events that took place over that time period. There were a lot of things going on in terms of the creation of healthcare and how to better implement it in terms of bringing it to the people in a more established and streamlined format. So, first, the first medical schools were established in 1765. The first one was located at the University of Pennsylvania, and medical students prior to this had previously trained under private physicians because the hospitals that were created before this were typically pretty run down and not a place to have medical students train. So they trained with private physicians in their private offices until this medical school was established to give them a space to train in. Next, we have the establishment of the American Medical Association. This took place in 1847. It was a physicians' membership organization, meaning only physicians could be a part of the group. And it became official in the 1900s, where more and more physicians started to join the membership. It was also created to kind of organize the physicians around the country and states, and it kind of listed them in alphabetical order, made it a little bit easier to kind of pinpoint where those physicians were located at. After that, in about 1904, the American Medical Association was established, and they established or helped to establish the standards for medical care. This is also around the time where the Council on Medical Education, was created, and it helped create a more formal and streamlined format for education within the healthcare industry. After that, hospital specialty was created, meaning that in 1996, hospitals would only provide care to patients while they were hospitalized, not any time before or after. And it further specialized the view on how hospitals were run. So it made those areas more specialty and less primary care facilities for people who were not well off, for the poorer communities. The Joint Commission issued standards of care or standards to increase consumer awareness for hospitals in 2002. This also took place around the same time that the HCAHPS tests and surveys were created by the CMS and the AHRQ. So there was a lot of updating and standard increasing going on at that time. And it required for hospitals to inform their patients of test results that were atypical. And so most of us get those kind of formal letters to us now that state whether or not our results are atypical, and it's typically followed up by a phone call or something of the sort to kind of go over your results and let you know if you have any questions as the consumer. And so this change to the health industry really has taken root and grown into something very great for consumers of today. In 2010, the Affordable Care Act was passed by the Obama presidency. This helped to ensure that all Americans, got some form of health insurance, whether that be Medicare and Medicaid, private insurance through whomever, employment insurance, any one of those items. This act kind of helped to set the pace for obtaining insurance for all Americans. And the point of this act was to improve the health of all America, and kind of get it on the same page. Prior to this, Americans weren't necessarily required to obtain health insurance, and so that was part of the reason why this act was passed. And finally, Centers for Medicare and Medicaid Services reduced Medicare payments to hospitals for exceeding readmission limits. This took place in 2015, and prior to this standard of care, the readmission limits or readmissions for many of the senior citizens or chronic disease patients were astonishingly high. And so Medicare and Medicaid really took it upon themselves to put this act together and say, hey, we're going to limit the readmissions for hospitals to a certain amount. And then if you're exceeding this amount within 30 days, like if your patients are coming back within 30 days of their release from the initial admission, then we are going to reduce your reimbursements levels. And this really helped to make sure and ensure that hospitals weren't just prescribing things that were not needed, testing for random illnesses, things like that. And so it really helps hospitals to kind of focus on what the real issue is with the patient and how to really get them on their own feet with the health issues that they may or may not have. So altogether, a lot of these things have helped to shape the way that we have healthcare now, and I believe that we will just continue to grow, and we will continue to see this industry grow in terms of what will happen next with acts and laws that are passed in the future.